Good morning, everyone. Just want to thank everyone for the awesome first day of the summit. I've learned so much, and we aspire to make this session as informative as the many we've had to date. So, as you can see, we have a lot of guests to welcome to the stage, so I'll make just a few brief opening remarks. And I want to start by saying, there are a lot of ways to assess whether an issue is breaking through as a political priority, as a policy priority. And we've talked in the first day about the climate and health agenda having some real momentum. We've congratulated ourselves on reaching milestones like the first health day at COP28, the passage of the landmark resolution at the World Health Assembly late last month, the advent of summits like this that bring together hundreds of passionate practitioners from across geographies and disciplines. But to throw a little bit of cold water on our enthusiasm, I think the best measure of whether we're breaking through is whether we're spending money on an issue. And by that measure, we're a long way from our goals on the climate and health agenda. Now, as we heard in the earlier session, the world is really ramping up its spending on climate writ large, on the energy transition. The latest estimates are that global spending levels have doubled in the past year to 1.3 trillion per year, according to the Climate Policy Initiative. But the best estimates are that the world's only spending about 1.1 billion per year to address the health adaptation needs of the most highly vulnerable low and middle income countries. So $1 billion is about a tenth of the estimated annual need for adaptation for low and middle income countries, according to the UNEP. And it's less than 0.1% of overall climate spending. One of the speakers yesterday on the nutrition panel was lamenting that nutrition is only accounts for about 3% of climate spending. Climate and health is 0.1%. It's not even a budget line. It's not even a rounding error in the overall climate financing agenda. Now, contrast that number, that tiny, paltry percentage, with the dimensions of the challenge that we face. And we heard about this yesterday in some detail. The World Bank estimates that 21 million additional people could die from the health impacts of climate change by 2050. Another World Bank study finds that 132 million people could be driven into extreme poverty by the impacts of climate change by 2030, by the end of the decade. So this isn't one of those far future 2070, 2080 projections. We're talking about within 6 years, 132 million people being driven into extreme poverty. And when you actually unpack that and look at the drivers, the single biggest driver is climate's impact on health, accounting for 44 million of those 132 million people. Now, the only way to avoid these outcomes is through investment, at scale, with urgency, and done smartly. We need to invest in saving lives and protecting health in a cost-effective way and in a way that's responsive to country needs. Now, the good news is the cavalry is coming. There's some real momentum and some real progress. Just to cite a few numbers, and you'll hear these again as we talk to our guests. Last year at COP28, the World Bank announced that it was upping the percentage of its overall portfolio that it's spending on climate action to 45%. So we'll talk in a minute to Tamer, Rabie from the World Bank. They do about $6 billion in new lending per year through their health portfolio. 45% of that is the target to address the intersection of climate and health. The Global Fund, and we'll hear from Peter Sands of the Global Fund in a minute, committed that 70% of its resources over the next 3 years, $9 billion, are going to be spent in the 50 most climate vulnerable countries. And the Green Climate Fund, which announced a pretty eye-popping number, $12.8 billion raised in their latest replenishment, fully half of that is intended to address the adaptation needs of countries with a real focus on the most vulnerable countries. So that's what we're here to talk about in this session, how we're turning awareness into action, how the financing pledges that we've heard about at a high level are translating to actual dollars and manat, saving actual lives in the countries that need it most. Now, This session is going to be a little bit of a high wire act. It was remarkable what the production team managed yesterday, how seamless everything was. I'll be truly impressed if we can manage that with this session and so many virtual participants. We're going to take this in 4 parts. We're building these as fireside chats, which is only appropriate given that we're here in Azerbaijan, the land of fire. So first, and appropriately, we'll set the scene by hearing from 2 representatives from the government of Indonesia. Laksmi Dhewanth, the Director General for Climate Change in Indonesia with the Ministry of Environment, and Dr. Anas Maruf, who's Director of Environmental Health at the Ministry of Health. Then we'll speak to 2 of the development banks who've been leading the charge on climate health financing. We'll talk to Tamer Rabie of the World Bank. Tamer, maybe you want to come up now. Tamer, thank you, Tamer, for joining us here in person. We'll also be joined virtually by Dinesh Arora of the Asian Development Bank. And together, Tamer and Dinesh, their institutions and partners, just last week launched a new roadmap for development bank action on climate and health. Third, we'll speak to Peter Sands, who's Executive Director of the Global Fund to Fight AIDS, TB, and Malaria. So we'll hear about how the largest grant financer of health in the world is responding to the climate crisis, and in particular, how it's working across sectors with some of its peers in development and environmental funding. And finally, we'll talk about the unique and catalytic role that philanthropy can play in this moment as the world tries to get organized and respond to the climate and health crisis. And so for that, we'll talk to Tala al-Ramahi, representing Reaching the Last Mile and the President's Court of the United Arab Emirates, who of course were hosts of COP28 last year. So I'll plan a fireside discussion with each of these 4 groups, but we really want to make this interactive, so I'd encourage you all to pull up your apps now and think about the questions that you want to be submitting and asking to the group. All right, switching seats. And not forgetting my pen. So to set the scene, we're excited to hear from representatives from the government of Indonesia. It looks like we have Dr. Anas available to join us.
Hello.
Hi, Dr. Anas. Welcome. Thank you so much for joining us. So we just heard a fantastic presentation from Professor Hammam about the Climate Smart Indonesia program and all the innovative ways that Indonesia is preparing for, responding, innovating to the climate crisis. I was really struck. Can you guys hear me?
No.
No. Can you hear me now?
Yeah.
All right. I'm going to call that user error. I think I may have covered the microphone here. Can you hear me now? Can I go back up here? All right, as previewed, a high wire act. All right. Microphone check. Excellent. All right. So, Dr. Anas, Indonesia, of course, is the 4th most populous country in the world with 275 million people. It's also, we talk so much about small island countries in the context of climate change. Indonesia is, by any measure, a large island country, more than 17,000 islands making up the country. Indonesia is also highly vulnerable to a lot of the climate impacts that we're talking about. How are you using climate and environment intelligence to plan for and build resilience in the health system in Indonesia?
Okay. Yeah, good afternoon in Indonesian time, because now we on 1 p.m. in Indonesian time. Thank you for the question. Firstly, I think I agree that the climate impact very serious to health consequence because directly or indirectly the impact of the climate change in the end is in health sectors. So I think very important to using climate and environment intelligence to develop the future scenarios. By definition, climate and environmental intelligence refers to the information and insight gained from scientific study, data analysis, and expert judgment on climate change and environmental challenge. We using the we use the climate and environmental intelligence in some of activities in Indonesia, both mitigation and also adaptation regarding the climate change control. Climate and environmental intelligence has key components that include scientific research, data analysis, modeling and prediction, risk assessment, policy recommendation, and also public awareness and education. Some activities already conducted by our government, especially in health sectors. First, we already conducted risk assessment and adaptation to climate change for climate-sensitive disease like dengue, malaria, pneumonia, diarrhea, and tuberculosis. We conducted this assessment, collaborate with the UNICEF and also from Institute Technology of Bandung, one of the famous university in Indonesia. The result of this assessment is some of the developed of climate-sensitive disease control. We develop of climate-sensitive disease control by environmental intelligence. Yeah. And the result of this risk assessment, how to we make strengthen the health database with integration of the case recording and reporting system. And another recommendation is enhancing coordination with another institution like Meteorological, Climatology, and Geophysical Agency for the provision of climate, and also we use the statistic agency data to provide data to disease risk vulnerable group based on age and gender. Second, we also conduct the health vulnerability adaptation assessment to climate sensitive disease. Yeah. We have map. We have map from this assessment, and the maps is the map also give us the map that how the area in Indonesia regarding the diseases sensitive of claim like dengue, malaria, pneumonia, and diarrhea. With this, the release of vulnerability of the disease from center to village level for adaptation program planning priorities. So I think very, very important to use the environmental intelligence. Another activities, we also conducted the modeling for awards. Yeah. Awards is means emergency early warning system. Yeah, I mean awards is early warning system regarding to control the some of the disease that sensitive to climate change like dengue and malaria. Also, we will conduct the reach of the awards to another diseases. We also have been develop the public communication about the impact of climate change through social media channels. This is also using the environmental intelligence. And another activities, we will conduct vulnerability adaptation assessment of healthcare facilities in cooperation with the Ministry of Education, Ministry of Health, Ministry of Forestry, and also with WHO. So it is very, very important because we committed to COP declaration that Indonesia will participate to decrease the carbonized in healthcare facility. Thank you.
Terrific. Dr. Maruf, really helpful to hear that. And a few key points jumped out to me. First of all, just how extensive the kind of assessment of the needs and risks are, the details around the planning all the way down to the village level, how you're using innovations like early warning systems and the climate smart Indonesia approach that you described. And we actually have a session tomorrow where we'll be talking about innovations in the fight against dengue. And of course, Indonesia has been the pioneer and demonstrated the compelling power of Wolbachia as one example.
Yeah.
So, Laksmi, so great to have you. Thank you very much for joining us. Of course, you serve as the Director General for Climate Change Control in Indonesia in the Ministry of Environment. Climate change control strikes me as an audacious phrase, the ability to control the climate. But tell us how you're thinking about the challenge. What are kind of the major risks, and how are you working across different parts of the government to coordinate action?
Yeah, well, good morning and good afternoon from Indonesia. Thank you for having me. And indeed, it is a very timely discussion we are having now, because we know that climate change, it's there, and we cannot, we don't have any luxury time to delay any actions. Indonesia is a nation yet stable democracy and fourth most populous country in the world. So, and Indonesia, it is mandated by our constitutions, inter alia. Our constitution mentioned that every person shall have the right to enjoy a good and healthy environment. So that's why climate change agenda is very important. Climate change presents significant risks for Indonesia's natural resources that will in turn impact the production and distribution of food, water, and energy. Climate change, which include the increasing global temperatures, irregular rainfall patterns, and extreme change in weather, as well as the economic, especially concerning an increased hydrometeorological disasters. So, in short, Indonesia is very prone to natural disaster, primarily related to hydrometeorological events, such as flood, landslides, and drought. And this disaster can cause enormous economic and social losses. So therefore, it is vital to holistically address climate change from environment, social, and economic impact. So Indonesia is very committed to the climate change agenda, and against the mentioned background, the government of Indonesia consider climate change, both mitigations and adaptations effort, as an integrated concept that is essential for building resilience in safeguarding food, water, energy, as well as health. So the government of Indonesia made a very significant effort. We are working our commitments towards developing and implementing a national economic plan of climate change. As regard to nationally determined contribution, the document that as the parties of UNFCCC, Indonesia submitted its NDC, which consists of its target to reduce the greenhouse gas emission, as well as the target on adaptations in reducing risks and enhance adaptive capacity and strengthen resilience and reduce vulnerability to the climate change. Indonesian's NDC, I can call it Indonesian NDC is it's a widened sector. So it's not only talking about one sector, but we cover most of the sectors, namely forest and land under use, energy, industry, agriculture, and waste. And we will have another sector like blue carbon in our next NDC. So that's why working together and coordination among ministries, line ministries, sectorals, as well as with the non-party stakeholders, namely local governments, businesses, academia, societies, it's very important. That's why we have to, inter alia, enhance climate literacy among the stakeholders, building the capacity to strengthen all the stakeholders, improve knowledge management, convergence policy on climate change, both adaptations, mitigation, as well as disaster risk reductions, as well as we would like to apply an adaptive technology. So yeah, we are very committed and very focused on our climate agenda, because we believe that by carrying out a tangible and concrete effort, that's the only way to anticipate and to address the current climate change impact, especially for Indonesia. So it is, of course, it is a challenge to work with all sectors, and Ministry of Environment and Forestry as the national focal point of UNFCCC. We have a forum, we call it Friends of NDC, consists of all sectors.
All right. Looks like Laksmi may have frozen, but that's a great note to end on. Friends of NDC and all of the different sectors and stakeholders that are involved in developing a country's nationally determined contributions. So we're going to move now to talking about, we've just heard the country perspective and how critical coordination is within the country. There's another layer of coordination. How do we coordinate with the global financing institutions that are making concessional loans and grant financing and other forms of investment available to countries to address these climate-driven health risks? And for that, we'll start with a conversation with two representatives of a large and growing group of development banks that are now part of the Development Bank's Working Group on Climate and Health Financing. So first, let me introduce a medical doctor. Tamer Rabie is the Global Program Lead for Climate and Health at the World Bank's Health, Nutrition, and Population Global Practice, where he also led the World Bank's efforts in launching its climate change and health program at COP28 last year. Congratulations.
Thank you.
The program aims to maximize financing for climate and health and scale up action at a global level to reach the most vulnerable populations in the world. So very much in line with the goals we're talking about here today. Let me also welcome Dinesh Arora. Dinesh, hi Dinesh, thank you for joining us remotely. That's a snazzy backdrop you have. It looks great. So Dinesh Arora is Principal Health Specialist at the Asian Development Bank. He previously served as Mission Director for Health in the state of Kerala in India, which of course had its own catastrophic flooding events back in 2018, as many will remember. He also served as Director of Health at Niti Aayog, which is the Indian government's top policy think tank where a lot of these ideas originate. He was also a founder and deputy CEO of India's National Health Authority and led the world's largest health insurance scheme in that capacity, among many other facets of his career. So let's jump in, and Tamer, as the guest who joined us in person, I know you maybe had a question for our Indonesian colleagues. Is Dr. Anas still with us, and do you want to pose a question to him before we turn to questions about the development banks?
Yeah, I think that would be great if he's still with us.
Can we get a high sign from the back? Is Dr. Anas with us? I'm seeing hands waving, but I don't know how to interpret that. No, he isn't.
Okay.
It says. All right, great. So let's jump right into talking about the roles of the development banks. And Ajay Banga, of course, is the new head of the World Bank. Ajay comes from the private sector, and on taking the office, he updated the vision and mission of the World Bank to, quote, a world free of poverty on a livable planet. And he added that on a livable planet part. So how does climate's impacts on health fit into that updated and expanded vision for the World Bank?
Excellent. Well, first of all, thank you very much, Martin, for the invitation to join you here in Baku, Azerbaijan. I want to start off at the beginning by just thanking the government of Azerbaijan for hosting us, for taking on board also the presidency of COP this year, COP29, and of course for the efforts that you have been pushing ahead with through the Forecasting Healthy Futures Summit. Before perhaps responding immediately to the question about how we've been thinking about the World Bank's mission and vision and the expansion to include a livable planet, let's just be reminded of why we're here. I think we've heard it this morning when our colleague and friend Vanessa Carey spoke, that it's about people. And the reason we're here today is really to discuss people's lives, people's livelihoods. And again, the numbers that you've mentioned are starking, and I think that we need to put a lot of emphasis on these. You know, it's no surprise at all that the climate crisis is indeed a health crisis, and it's a message that we've been hearing time and again in different international fora. We do know, as you mentioned this morning, or earlier actually in the session, that nearly 21 million people would lose their lives as a result of the climate crisis. This is based on only 5 climate-sensitive health risks. So it's an analysis that we did in the World Bank that really shows us what potentially may be the impact of the climate crisis on people's lives and livelihoods. Now, this is only the tip of the iceberg, and make no mistake about this. The numbers are far more than the 21 million they're currently being quoted. At the same time, when we put that in economic terms, we're seeing that nearly $1.6 trillion would be the size of the economic losses annually. Now, that's a huge number. For many of the countries, obviously, that we're working in, it actually has impacts on their overall performance. It has an impact on their fiscal space. And what is it that they can bring in terms of services to people? The number that was not mentioned, and I think is going to be important also to put on the table, is the fact that by 2050, we're probably going to be seeing at least 1 billion climate migrants as a result of extreme weather events. And that, of course, has implications on their health, the systems that host those refugees or displaced populations. So therefore, we have to keep our eye focused on the fact that this is a story of poverty. 44 million people being pushed into extreme poverty. This is a story of displacements, people losing their lives and livelihoods. And this is an economic story as well that will be impacting on government's overall ability to be able to provide, for the kind of services that their people are demanding for. We heard from Indonesia in them saying that, that in Indonesia, it's a right for every person to have a healthy lives. Now, shifting and specifically coming to your question on why a livable planet, so why that was added as a modification to the bank's vision. I think it's a recognition that there is this reciprocal interlinkages between human life and the environment that we live in, that we all have a collective responsibility to maintain. At the same time, this is a reminder that we have to, with the urgency to address the global crises, but we have to match to the scale that is needed in that respect. And I think with the addition of a livable planet in the World Bank's vision, this has applied a laser focus on what needs to be done to be able to address the climate crisis. Hence, that's why you've mentioned at the beginning that we have increased our commitment, our share of financing towards climate action to 45% by this coming fiscal year, 2025. And at the same time, at the spring meetings, we also made another commitment, which is that we are, with partners, obviously working to reach 1.5 billion people with affordable quality healthcare by 2030. Now, the two combined form our sort of North Star in what the World Bank needs to be able to do to address the climate crisis, and how is it that we could work together to maximize finance and scale up action for climate and health.
Fantastic. 1.5 billion being almost half of the number of people that are estimated to be highly climate vulnerable by the IPCC. Dinesh, want to draw you into the conversation. And of course, the Asian Development Bank has been a first mover on climate and health. And as the name implies, you're working in a region that's heavily climate impacted. We talked about Kerala and the flooding. The stories are almost monthly about extreme heat waves, about flooding events, about huge upsurges and outbreaks of dengue fever, for instance, in a number of the countries in the region. And one of the things you did last year, you announced it or previewed it at the G20 in India and then announced it at COP28, is set up a special climate and health initiative at the ADB. Can you tell us kind of what motivated you to set up that initiative, and how's it going so far?
Thank you, Martin, for this invitation, and apologies for not being in person there. Had some competing priorities. Hi, Tamer, and hi, everyone. Absolutely, Martin. Let me share the story with you. When you talk about crisis in Kerala, I just wanted to highlight that last week we had the maximum temperature in Delhi, 52.3 degrees Celsius. And at the same time, Kerala had floods with one of the hospitals in Calicut, the medical college, getting flooded for the first time in 70 years. So imagine the catastrophic impact which climate brings directly on health. Martin, let me give you a context of how this journey of G20 shaped up for Asian Development Bank. Well, Asian Development Bank is positioning itself as a climate bank for Asia and Pacific with a 100 billion commitment on climate financing for all sectors. When we started discussing about climate and health, there was a little less buy-in from the G20 countries, and we came up with an issue paper of what are the barriers which actually impede multilateral financing. I'm happy you said 1%, because our research showed by last year it was 0.39% of the multilateral financing going into core health. Let's leave aside the core benefits which come as an auxiliary. We analyzed what are the barriers which hit countries and why climate and health has not been mainstreamed. In fact, I will say where health has been lost in the hindsight in the climate journey. First of all is the information barrier, I guess. People really do not understand the risks which climate causes to the health. And secondly, what potential benefits come by adaptation and mitigation. And this is at every level. We went to a country, and it's a pretty advanced country in Asia and Pacific, and we talked about climate and health, and they said, excuse me, do you think we should leave UHC, Universal Healthcare, and talk about climate and health? Is that the priority? I just want to impress on one thing to everyone here, that climate and health is not in vacuum. Climate and health needs to be inbuilt part of our health reforms. When we do UHC, when we're doing health workforce, when we're doing health financing, we need to have climate and health as an internal element for this. So, Martin, there were 5 barriers which we found there. One was information failure. Second, the human capacity, the workforce capacity to deal with proactively with crisis. For example, when a flood hits, we know there are going to be malnourishment. We know there is going to be diarrheal diseases. We know that it can lead to increased snake bites and perhaps other diseases like malaria. Is our community health workers sensitized enough to have that medical kits stored at a higher place so that they don't get flooded, or the SOPs there? Perhaps not. Third is, of course, the siloed approach. So music to hear from Indonesia when we had the health counterpart and the climate counterpart speaking together in one language. We have silos within departments, whether it's health services or medical education. Silos between human health, animal health, and environmental health. So that are the big issues which we thought was one of the barriers. Data systems regarding their timeliness, quality, management, analysis does not exist. How often do we map catastrophic diseases and the climate change and the burden of disease to see how resources can be earmarked? And fifthly, most importantly, lack of community involvement, the local solutions, the leveraging of the private sector to come up with this. So when we came to the government of India, asked us to work on the issue note, there was a little less buy-in. We did a side event in Goa. We got a much better buy-in. There were about 120 delegates across the world participating. And in the third working group, actually, it became a mainstream topic of climate and health. And we came up with the 5 high-level principles of climate and health, which is very resonance with what we did in COP, what we are doing with Tamer on the joint working group. The first principle on resilient health, The second on sustainable and decarbonizing health systems with quality health. Third principle on decarbonizing supply chains. Fourth principle on novel financing. And fifth on the One Health with animal health and CDC institutions and environment. In fact, they are in total alignment with attach the principles. If in one line I have to describe, so CHI will incubate innovations in climate health solutions and take them to scale. That's a one line tag if you want to ask me. We have already put about 10 million as a seed money, and we are looking for working with different countries on scaling up the innovations which we are doing. For example, at the WHA, we did highlight 20 innovations with HIEX at one of the side events, which is the future proofing of the climate and health. So this is where we are as present on the CHI. We are going to conduct a stakeholder analysis in India with all the states and come up with the health plans. In fact, the Indian World Bank team is also going to be a partner in this. And also, so I think, Martin, you are aware that we're conducting a global event on climate-induced epidemiology at Tokyo on malaria and TB. So ADB is positioning itself on the climate and health front, and we are looking forward to work with partners to mainstream this and work together. Thank you.
Dinesh, thanks so much, and great to hear about the commitment and progress that you're making at the Asian Development Bank. I look forward to participating in that panel on malaria and dengue that I know is coming up. I think I'll be getting up very late, my time in Seattle, to join you for that panel. Of course.
Before you go on to your next question, if you just allow me to
please.
jump in on one thing.
Jump in.
Because I think that, Dinesh reminded us of three very important points that also came out in Vanessa Carey's remarks. Ultimately, the climate crisis is a health systems crisis. So this is about ensuring that we're addressing climate through a health system strengthening approach. And I just wanted to, underline that. The second point that I think is extremely important is in ensuring that this is both an adaptation, resilience, as well as a mitigation agenda.
Yeah.
So this is not just about the focus on carbon emissions, but it's about how we can save lives, how we can protect people from not falling into poverty, and at the same time also how can we reduce emissions. And I think it's an important point also to underline as part of this conversation. And then I think the third point is that we need to keep people at the heart of climate investment and action. So taking a people-centered approach to how we think about, climate action is important. And this is why the program that we launched at COP28 came in with a specific focus to be able to bring in a people-centered approach to climate action, transforming the World Bank's $34 billion of active portfolio so that it becomes more climate informed, more climate resilient, while at the same time, as you were saying, really scaling up action so that we could make use of the additional $6 billion annual investments that the World Bank does in health system strengthening. So thanks for the opportunity just to highlight
fantastic.
those.
So you've talked first about how the World Bank and Asian Development Bank respectively are responding in their programming. But you're not stopping there. You're both playing a real lead and coordinating role in this joint development bank's roadmap and the MDB and DB working group on climate and health financing. Congratulations on your launch of the roadmap last week. I know that was a long time in coming. We participated very early on in some of that work with you. And I was struck by how you've been able to get so many institutions on the same page, rowing in the same direction. Talk to us about the key elements of that framework and how you and the other development banks are coordinating. Maybe to you first, Tamer.
Excellent. Well, thank you very much, Martin, for bringing up this point around the development bank's working group for climate and health finance. I'm very happy to see Dinesh on the screen as well. We've been partners in crime in pushing this forward, with the other development banks. So we've established this working group in the lead up to COP28 with the recognition that the scale of the crisis is huge and that no one organization can do it alone. This was about bringing in the development banks together to harmonize on our tools, instruments, and financing, and in fact, even anchoring country-level co-financing opportunities. The group at the moment brings together 8 multilateral development banks and several public development banks, including the South African Development Bank, the Rwandan, the Brazilian, KfW, as well as the Agence Française de Développement. And we also have the International Finance Corporation representing the private sector interests, if you will, within this group. Now, what we have been able to do through the group and the launch of the roadmap is to define how collectively we're going to be addressing the climate and health crisis. And we came up with 6 foundational pillars that define how the development banks are going to be working together. The first one is coming in really to focus on understanding climate and health investments. This is something that we've been speaking about for quite some time. And in fact, I recall WHA last year, we had our first initial discussions among a wider group of development partners, not just development banks, in saying, well, you know, money is important, but we need to be able to understand money for what? How are we going to be spending that money? How do we define climate and health investments? What does it mean to be scaling up climate adaptation? What would be the policies interventions that we can bring to the forefront in that respect? And the development banks are coming in to really focus and hone in on understanding these climate and health investments. That's our first pillar. Our second pillar is coming in really to identify country vulnerabilities. And this is, we've heard from our colleagues from Indonesia. I mean, each country has a very specific context that they operate in. It's not a one-size-fits-all. There are natural disasters, for example, in Indonesia. We've heard from Dinesh talking also about, you know, the situation in India. We know of what's going on in other countries like Madagascar and others like in fragile conflict situations like Yemen. So the contexts are different. So we need to be able to take this to ground zero, where we're able to understand vulnerabilities, we're able to understand risks, and we're at the same time able to understand the adaptive capacity of health systems to deal with those risks. So that's the second pillar, and putting in place harmonized diagnostics that can get us to understand national as well as subnational risks is extremely important. The third pillar is about capacity. So this is recognizing that we're all on a learning curve. This is us at the global level, but equally so our partners in governments. So our focus is on increasing capacity, and not just in health ministries, but this is increasing capacity across the board. I was extremely happy to hear of how Indonesia has been tackling the crisis, taking this sort of all society approach and how they do this. But we need to be able to get everybody on the same level to ensure that we're all speaking the same language. So the capacity development is for ministries of health, ministries of environment and climate change, ministries of finance, also to bring them into those discussions to be able to understand the cost of inaction and potentially the cost benefit of action. The fourth one is actually on supporting country-driven, evidence-based solutions. So ultimately, the discussion that we're having today is about how can we get financing to push solutions that are country-tailored and country-owned. So this is about creating the evidence on those solutions, understanding potentially what may constitute the best buys. And I'm calling it the best buys with inverted commas, because I do not want anybody to be making a mistake that this is going to be the silver bullet that resolves everything that we have, that relates to the climate and health crisis. But at least we're going to be together able to identify those interventions that are the most impactful, those interventions that potentially may give us the highest returns on investments, those interventions that are scalable and are feasible within country contexts. So this is going to be a big focus of what the development banks do, and we are joining partners outside the development banks arena in this on this. The fifth one is actually a pillar that is extremely important. After all, everybody, when they see us, the dollar sign, immediately shows up on their eyes. So it has to be about finance. Yeah. How do we mobilize synergistic financing across the development banks? How do we ensure that we're coming up with co-financing opportunities that actually scale up action at a country level? And I'm going to use the Indonesia example again. We have already worked in Indonesia in putting together a $4 billion co-financing program in Indonesia. This was together with the Asian Development Bank. Dinesh, you're obviously very aware of this. It was also with the Asian Infrastructure Investment Bank and the Islamic Development Bank, together with the World Bank. So these development banks came together. They've put together a program in Indonesia, of course, with the government, to ensure that we're able to really match the scale of the crisis that we've been hearing. And I want to end on the sixth pillar, which I think is extremely important. It is about results, and it's about transparency, and it's about accountability. Make no mistake about this. If we do not put in place metrics that will help us measure success, where we're heading to, we will not reach that point. So this is about really keeping us all honest, keeping us accountable, and putting out to the world how far we're able to scale up financing and how far we're able to maximize the finance that we bring into this space to be able to bring solutions at a country level.
Terrific. Thanks, Tamer. Dinesh, as we just heard from Tamer, a fantastic framework. I was really compelled by how it featured not only looking at what the climate-driven needs are and the populations who benefit, but what are the cost-effective solutions? How do you invest in ways that are measurable? Dollars for DALIs, dollars for deaths, dollars for reduction in CO2. But ultimately, we need to get the dollars flowing. Ultimately, we need to start to see investments at scale on the ground, as the example from Indonesia indicates. What's it going to take? What are the next steps to operationalize this roadmap to actually get co-investment going among the DBs, the development banks, and with your partners more broadly, your financing partners around the world?
No, thanks, Martin, and thanks, Tamer, for that excellent description.
We need to get the dollars.
So Martin, the first year on the roadmap, we actually worked together, putting up the framework, roadmap, and bringing everyone together. And now the real work starts. In fact, we all are country driven. And when we go to the country asks us, okay, this is your joint MDB forum principles. This is your G20 health principles. What next? What are you going to implement? What are you going to help us with? So let me take an example here. So we plan to invest about 2 billion in India on the health and the climate sphere, and the government is buying. So government said, let's come up with first what can be done on resilience and adaptation. Mitigation will be the next step, and that's what Tamer said. It has to be both balanced adaptation and mitigation. Now we have identified with government 8 priorities. Let me give an examples like heat stress mapping, about 5 cities in India. We're talking about early warning systems in Philippines, in a county of Tabaco, where we are superimposing climate data with burden of disease and having excellent correlation of how when floods hit, the poverty levels go high, the disease burden goes high, the snake bites went high, so all these correlation came. Third, we are working on a clean cities with the pollution assessment and abatement policy. Fourth, on the resilient infrastructure, like we're having a climate smart hospital, 6 hospitals we are setting up in Thailand, or the vaccine supply chain in Bangladesh, which is going to be green bio-waste management. We are working on the climate-induced epidemiology on malaria, dengue, and TB. For example, last year, Bangladesh was very badly hit with a disease like dengue, being seasonal, became perennial, with about 87,000 cases and about 1,000 deaths only due to dengue. We are working on an accelerator course to come up with capacity building, both within ADB, outside ADB, on workforce, on how climate and health can be intentionally brought out in each and every action we do. I think it's important, Martin, that each one of us realizes our duty and we all intentionally bring climate and health into whatever we do, whether it's vaccines, whether it's Global Fund, whether it's Gavi, it's GCF, where we are going to partner with. We recently signed, I see Peter on the screen, an agreement, an MOU with them on how we will work together with ADB and Global Fund on financing, on TB, on malaria. I think it's important that we come together as partners and start working on the practical implementation things. So we need to find out innovative climate health solutions and then take them to scale. I think in our journey right now, 3 steps I find it very important. 1, continue the political buy-in and advocacy, whether it's like COP or it's G20 or it's WHA or the HSR in Nagasaki, which is going to come. Second, we also need to do internally, increase our capacities. Tamer and I would be working on the joint methodology of MDBs, how we can refine them, sure, to avoid criticism like we had last year, both banks faced from the Oxfam about the methodology, and how we can actually further refine it, make it more attuned to climate and health within measurement of especially of the adaptation, and of course the enablers which are required for different countries driven processes. And third, of course, the practical implementation. So ADB has professed that $1 of grant financing, ADB will have at least catalytic financing of $6 of increased co-investments within the countries to come together and help countries nudge towards climate and health. So this is, in short, we are trying to do a pilot implementation in few countries, show a demonstration effect. We have defined the ADB area into three sides: the South Asia and the Southeast Asia, the Central West Asia, and especially the SIDS. So we are working with the Green Climate Financing, the philanthropies, FCDO, to come together with the workable solutions of nudging countries to move towards climate health solutions. What in initial phase we say the best buys, but then take demonstration and take them to scale. Thanks.
Terrific. Thank you so much. Please join me in thanking Tamer, Rabie of the World Bank, Dinesh, Arora of the Asian Development Bank for joining us today.
Thank you.
And I understand we have Peter Sands available to join us remotely now. Hi, Peter. Welcome.
Hi, Martin.
You have a loud
Can you hear me well?
We can, and we can see you well. You look great. Blue's your color. So, Peter's known to many in the room. He's the executive director of the Global Fund to fight AIDS, TB, and malaria since 2018. The Global Fund, of course, is the largest grant financing institution for health, responsible for saving 59 million lives since it was established 20 years ago. And Peter and the Global Fund team are gearing up for their next replenishment, which will start at the end of this year. Peter, the Global Fund, of course, was created to respond to a different crisis or set of crises. It was created to respond to the three biggest diseases and disease burdens in the developing world: AIDS, TB, and malaria. Climate change was not on the agenda at that point. It wasn't contemplated as part of this work and mission, and yet you're finding now that it's an inescapable part of how you address the three diseases. How is the Global Fund responding to climate's impact on the three diseases and the broader health systems that the Global Fund supports?
Well, thanks, Martin. And I think you've got the essence of the challenge in your intro, which is that we won't succeed in beating HIV, TB, and malaria if we don't respond to the impact of climate change on health. That's most obvious with malaria. We've already seen the epidemiology of malaria, like other vector-borne diseases, changing quite rapidly, both because of the gradual changes in temperature, which are making some places which were previously too cold for the mosquitoes to now actually have malaria. And also the increasing frequency of extreme weather events, whether that's the flooding in Pakistan or the cyclones hitting Malawi and Mozambique, or even more recently in East Africa, the floods hitting Kenya, Burundi, and so on. And what you immediately see in those instances is surges in vector-borne diseases. In some instances, cholera, but also almost invariably surges in malaria. But you also see other impacts on the other two diseases. I was in Bangladesh last week, and in Bangladesh, the biggest killer is tuberculosis. They have made extraordinary progress in reducing the death toll from TB, but it still is a big killer. What's interesting, though, and it's not obvious what the impact of climate change is on that. However, if you go into the informal housing, the slums of Dhaka, which are enormous, millions of people live there, and you go with community health workers, as I did, and meet TB patients, who are they? Well, they are people from the coast districts of Bangladesh who have left those places because their livelihoods and homes have been destroyed by cyclones. Salination has impacted agricultural productivity, and they've ended up in the slums of Dhaka, living in extreme poverty, multiple adults to one room, and they're the people who are every single TB patient I saw in Dhaka was from the coastal districts. And so while the link between climate change and malaria is really obvious, the other diseases are also heavily affected. The way the Global Fund has been responding is basically in 3 different ways. One is responding to these climate-driven extreme weather events, which we are seeing with increasing frequency. For example, when Pakistan got impacted by the severe flooding, malaria cases went up by a factor of 4. We put in an extra $30 million through emergency funding to protect children, to restore bed net coverage, and to repair some of the damage to healthcare facilities. Most recently, we've just been releasing we've started with a couple of $1 million. It'll probably be more money to Kenya to cope with the impact of the flooding that we've seen just a couple of weeks ago. So that's one aspect of it. A second aspect of it reflects our focus on building strong and resilient health systems, and the Global Fund is the largest provider of grants for health systems in low and middle income countries. And there's a lot of things we are doing already here. One of the key focuses is making sure supply chains are made more resilient. What we're seeing is a pattern of losses of valuable medical commodities, medicines, diagnostics, and so on, due to flooding. It seems a bit ironic that many medical warehouses appear to be built in floodplains, I suppose, because it's nice flat land. But that's not great when you've got an increasing frequency of floods. So we're working with countries on how to make sure that their supply chains protect valuable medicines, diagnostics, and ensure their continued delivery at times of stress. But I think we're only just scratching the surface of what it means to build stronger and more climate resilient health systems. And then the third aspect, which is important, but what I would say is in the context of low and low middle income countries is less important than adaptation, is the mitigation aspect, which is helping the solarization of healthcare facilities, ensuring that waste management is more effective, so that even in the poorest places, we're helping countries play their part in ensuring that we're not making the problem worse.
That's great, Peter. And solarization, of course, is a great example of something that's good for the environment, but also provides reliable energy, which is huge for live births and other health impacts. So this panel is about financing, and we mentioned at the top that the Global Fund has made a commitment that 70% of its financing over the current 3-year period, about $9 billion, will go to the 50 most climate vulnerable countries. And my sense is that didn't take a major shift in strategy. Those are the places that you're already working, right? That's where the disease burden is highest and where the Global Fund is responding. But one of the announcements that you made at COP28 last year was financing co-investment commitments with AGE and the World Bank, with Mafalda, Dhewanth, and the Green Climate Fund. We just heard from Dinesh that the Global Fund is also working with the Asian Development Bank. What's the goal of these partnerships, and what do you hope it'll mean for countries?
Well, first I want to pick up on the 70% of our financing going to the 50 most climate vulnerable countries. I don't want to say, oh, we've pivoted our strategy and we're suddenly putting all this money in those places. The reality is those are the places with the biggest disease burdens and the greatest poverty and the most need anyway. And the way you should think about that is climate change is just going to make those needs greater and more urgent. If you do a map of malaria incidence in the world and a map of the most vulnerable, climate vulnerable countries, it's a pretty good
It's the same.
overlap. So I think one of the reasons we need to approach this whole problem with a real sense of urgency is that the people who are most exposed to the impact of climate change on health are the people who are already suffering the most. On the partnerships point, yes, you're right. We've cemented in an MOU a partnership on this issue with the World Bank. We're working with Mafalda and the Green Climate Fund, and we've recently signed another MOU with the Asian Development Bank. The first point is the recognition that none of us is in a position to deal with this on our own. The scale of the challenges and the complexity of them require different partners to work together. And also, we want to ensure that we try and make this as straightforward as possible for countries. There's a trend in the, not a trend, but a characteristic of the health and development world that when something new happens, we create different mechanisms, different ways of dealing with it. And in some ways, there's merit in that because it's tailored to the particular challenge, but it creates enormous complexity and inefficiency. And we want to ensure that the way we respond to these challenges is consistent with and builds on what's happening already. And that's particularly important because most of the things you do to respond to the impact of climate change on health are extensions or developments of things that need to be happening anyway. There's a huge amount of work going on to strengthen and improve the effectiveness of supply chains. You don't want something to be sort of bolted on in a very different way just to improve the climate resilient aspect of it. Likewise, when you think about disease surveillance programs need to incorporate climate sensitivity, but we don't want them to be kind of different disease surveillance programs. So I think working together with partners is a crucial element of this. And we also need to find ways of mobilizing more money. I think it's fair to say that a bit of sort of self-criticism, the global health community was pretty slow to wake up to the scale of the impact of climate change. We were putting most of our attention into COVID-19, the aftermath of COVID-19 on health systems. But now we've got to pivot and really face up to a challenge that is, in my view, escalating faster than most of the modeling suggested. And I would also say the climate change community was slow to see the health aspect of it. So from both sides, we've got to now sort of come together, mobilize resource, and make the best use of that resource to help the countries and communities most at risk.
Fantastic. Peter, one final question for you, and I know you've got to get on to your next meeting. You know, I've worked closely with you and your colleagues. My sense is you have pivoted in the past year since you joined us at the first Forecasting Healthy Futures Summit in Abu Dhabi. The Global Fund has come a long way in its kind of thinking and strategy and response to climate change. You will be here in Azerbaijan in November for COP29. Where do you want the Global Fund to be by the time you and your colleagues and peers show up here in Baku?
Well, the reality is we need to be doing things. And by doing things, I mean not announcing financial commitments and not announcing plans or pilots, but together we need to be ensuring that countries are enabled to be actually doing things on the ground that impact the people most at risk. We don't have the luxury of time. Things are happening pretty rapidly. Me and my colleagues during WHA had 57 meetings with ministers of health over the course of the WHA week. Most of those meetings, one of the biggest asks we were getting from countries was help in dealing with this problem. It's really gone incredibly rapidly from being a topic that before COP28 was sort of occasionally coming up in conversations with ministers of health to be one of the primary issues facing them. We need to be responding to that at pace. So I would be hoping that by the time we're gathering in Azerbaijan for COP29 is that we are really talking about what is happening, what is working, what are we learning, and how can we build on sort of real tangible things that are happening in the places most at risk.
That's a great note to end on. Please thank me in joining Peter Sands.
Thank you.
Thanks, Peter. And for our final segment of the movable feast, the fireside chats, please welcome Tala. Tala is Director of Office of Development Affairs for the Presidential Court of Abu Dhabi. She also serves as the Chief Strategy Officer, setting the direction for Reaching the Last Mile. And on a personal note, Tala and Reaching the Last Mile have been real partners, founding partners to the Forecasting Healthy Futures Partnership, and of course, co-hosted the inaugural summit last year. So Tala, thank you for joining us.
Thank you, Martin. I'm sorry I couldn't be there in person. As much as I tried, Eid celebrations got in the way. So Eid Mubarak to everyone who has celebrated over the last few days, and happy to join virtually at least.
Thanks so much for being here, Tala. And of course, we look forward to seeing you here in November for COP29. So last year, at the first Forecasting Healthy Futures Summit, UAE announced that they would host the first ever Health Day at COP28. We've heard from a number of speakers and partners, including Vanessa Carey earlier, what a watershed event that was. What surprised you most about the response over the past year to that announcement and to the mobilization it created around Health Day?
Yeah, thank you so much, Martin, for this question. It's great to hear reflections from Peter and some of the other partners that have been with us since day zero, really, of championing Health Day and setting it on the agenda. I think for many, as you said, Martin, COP28 was a real watershed moment for everyone in the global health community. It marked the first time we've really seen health concretely integrated into the climate agenda and globally acknowledged as an urgent priority. It also showed the world, perhaps for the first time, that at such scale and at such a high-profile stage, that health effects of climate change are not abstract future events. They are here, they are now, and they are striking communities and countries least equipped to bear them. There are also some tangible legacy outcomes to being the first COP to host a dedicated Health Day. Many financing players that you've already heard from at Forecasting Healthy Futures had committed financing to climate and health with more than $1 billion pledged for climate and health solutions from both established and new players in this space, including, which was already referenced, a climate health ministerial and subsequently a declaration endorsed by over 120 countries during Health Day at COP28. The launch of the blueprint as well that Tamer mentioned on climate and health financing was also a watershed moment for us, because for a very long time, Martin, as you've been very well aware, there hasn't been a guiding framework for how to finance and identify climate and health innovations, and what it meant really to identify solutions that are in the climate and health space. So that blueprint really put in a framework for us to think more concretely about how to do so. And we've been very privileged as Reaching the Last Mile to endorse this blueprint along with over 41 partners at COP28. But I believe there have been more partners that have come on board to support this blueprint even after Health Day at COP28. I guess as I reflect on the past year and the early legacy of COP28, I feel there are three elements that really stand out for us as the UAE and as partners who have been involved in this effort. First, to really see the swell of momentum and the need to ensure that this progress is in support of climate and health action, and ensuring that momentum is not lost, most importantly. For many of us here today, the climate crisis has always been synonymous with health. Vanessa Carey says this all the time, the climate crisis is a health crisis. We within the global health community understand this very, very clearly. But I think in recent months, we've been equally amazed and delighted by the diversity of partners, countries, donors that we've met with and that have become much more vocal about the need to act and catalyze funding in the climate and health space. Second, I have been reminded as well by the urgent need for more cross-sectoral platforms and pathways. Often when we talk about the climate and health crisis, we talk about it in the silos of global health. And I think that really needs to change. And again, Vanessa alluded to that during her earlier comments this morning. We cannot afford to be siloed in our approaches. And there are far too few cross-consultative routes and forums. We believe Forecasting Healthy Futures as a summit hope to shape and break those silos in many ways during our first forum last year, and continuing on this effort moving forward through catalyzing both conversations but also action across sectors. And then third, and I have said this very often, I continue to be concerned about how much we still don't know. Of course, there's a lot that we do know and must act upon. And even for the information or the data that is still not available, that doesn't give us it doesn't give us allowances to not act. But there still needs to be more that we can do in investing in the data that many donors frankly require to be able to commit major financing towards climate and health. So bridging this research divide is essential for informing both the development of targeted and effective measures in this work, and to protecting more broadly our planet and populations. And the only way to do this in a way that is very concrete for donors is presenting the data. And we hope to see more of that done moving forward.
Yeah, so many great points to pick up on, Tala. As you point out, we're still learning what works. Another data challenge is helping countries develop the modeling capacity and sophistication to just demonstrate how climate's contributing to disease burden and challenges. We've been talking to partners at the World Bank and the Green Climate Fund and others, and they've got a pretty high bar for demonstrating how climate contributes to a problem before they invest, and that's a real capacity gap for countries. As you think about the challenges and obstacles to getting to investment and response at scale, philanthropies have a unique role to play, particularly in this kind of early, messy period as we're identifying innovations, demonstrating those, collecting data. What do you see as the biggest challenges, and how are you in reaching the last mile and your kind of peers and partners that you're working with at other philanthropies responding to this moment?
Yeah, thank you, Martin. I think, with the groundswell momentum generated through Health Day with COP28, there is a clear opportunity to really catalyze and build on that. For us at Reaching the Last Mile, we've been quite eager to demonstrate how we can leverage data and the power of artificial intelligence through our partnership with Malaria No More, of course, on forecasting healthy futures. But obviously there's still a huge gap that needs to be addressed in investing in more data that is critical, and really addressing the hesitation of some donors to engage and really put their money where their mouth is when it comes to this agenda. Tamer mentioned the best buys. This is a conversation, Martin, as you're aware, and many in the global health space that have been engaged on health, they're aware that there have been conversations on what the best buys are, because often, again, when we talk about climate and health innovations and how we take them to scale, there wasn't a clear understanding or a broader kind of framework to lay out where the best buys were. And I'm glad that the group of MDBs that are really taking the lead on this are doing this for many of us who are quite interested in investing in some of these innovations and taking them to scale. And then again, with better data, we can only create the evidence-led interventions that eventually lead to these best buys. I think also equally, we need, with the current momentum, an opportunity to integrate climate change in public health practices and conversely, health into climate action. Peter spoke more broadly about the need for countries to take a health systems approach when tackling climate change, and often the countries that are most affected by climate change are the countries that first contribute the least to it, but are also the ones that are least able to address it when it hits their shores. So too often, countries currently that have either concrete resources or strategies in place that directly address climate and health inequities, yet many share the same determinants in the sense that now, or shall I say now, is really the time to advocate and to arm communities and public health practitioners with this information and the information that they need to make the asks for financing more persuasively from the likes of the Global Fund and the World Bank and others. And again, I think lastly, we have an unprecedented chance right now to engage and mobilize communities through a health frame. Social movements are often rooted in a shared concern or shared grievance, and of course, health touches the lives of everyone. It is perhaps one of the most effective tools we have in both dissolving the perception that climate change is an abstract concept to many, and to really talk about this in the lives lost and the lives that could be saved when addressing climate change from a health angle. So that's where we believe some of these challenges, but also opportunities lie in the way forward on climate and health.
And Tala, we heard just before this session from Professor Hamam, who presented on the Climate Smart Indonesia program. I think it's a great example of where philanthropy has played a catalytic role in demonstrating innovations. Of course, reaching the last mile, Mohammed bin Zayed University of AI have been integral partners and supporters of that program in Indonesia. So we're here in Azerbaijan, in Baku. I know you'll plan to join in November around COP29. Reflecting on how far we've come and where we're headed, what do you hope happens between now and then? If there was one thing that could change by the time you arrive here in Baku in November, what would that be?
It's a great question, Martin. When we began our advocacy around having a health day for the first time at a COP, our measure of success was literally to have a health day at a COP. Mm-hmm. But I don't think that's enough. Obviously, to have a health day at the COP is critical to have conversations around the impact of climate change on health, and centering that health conversation within COP is great. I think what we need to see now in subsequent COPs is real action around climate and health, really putting the money where it's needed most, and truly understanding for countries, creating better clarity on how to access that financing that's now available to them. We've heard often from countries that even though they realize that climate change is a challenge for them and for their own communities, often it's very hard for them to understand how to access climate and health financing, and even climate financing more broadly. I hope we're able to provide more clarity on that by the next COP. Reaching the last mile more specifically in our contribution to this, after listening to so many ministers of health speak to this so passionately, have co-invested with the Rockefeller Foundation and Foundation S on a major landscape report to identify all the financing opportunities that are available to countries, but also understanding how those financing flows are moving from the institutions to the countries, and also more practically how we can lay out a very tangible roadmap for countries to access that financing when they need it. So hopefully in a few months we'll be able to showcase the findings of this report and provide that as a real gift to countries that need this the most. So that's what I hope we really see as we build further momentum, is that with the momentum there is action to speak to this as well.
Tala, thanks so much for your leadership and your commitment to this issue. Thanks for joining us today. And everyone in the room, please join me in thanking Tala Al-Ramahi for her remarks.
Thank you, Martin, and thank you to everyone who sat in and listened.
Thanks, Tala. And that concludes our epic panel on climate and health financing. I want to thank all of our partners and guests who joined our see my mic stage. Peter Sands from the Global Fund, Tamer, Rabie, Arora from the World Bank, and the AD. Thanks.
Thank you, Martin, Tamer, and distinguished panelists for fascinating deep dive into the complexity of need on the